Thank you for sticking with us. We're going to talk about colon cancer and cancer of the rectum. They usually begin as a small polyp. While most colon polyps are benign, some do become cancerous. Colon cancer symptoms may include a change in bowel habits or bleeding, but usually colon cancer strikes without symptoms. That's why it's important to get a colon cancer screening test, such as a colonoscopy. Dr. Shauna Lorenzo-Rivero is with us today. She's a colorectal surgeon with University Surgical Associates. And we're going to talk about this month because this is a great time to be getting a checkup if you haven't had one. Screenings are very important, aren't they?
That's right. It is a lot easier to prevent a cancer rather than be diagnosed with one and have to undergo the treatment. So with colon cancer, the screening test, and it's important to get your screening test at the age of 50. That is the usual time for screening unless you have colon cancer in your family. Then you need to start at an earlier age, usually 10 years younger than the first person diagnosed with cancer in your family. Now there are high-risk groups. Those are people who have had colon polyps before or have had colon cancer, people who have inflammatory bowel disease, and there are cancer syndromes. For example, ovarian cancer, endometrial cancer, and colon cancer. But what's most important for the average American is that you need to have a colonoscopy at the age of 50.
Now, if you're in that high-risk group, do you want to do that twice a year, or can you, or is it best just once a year?
You don't want to do it twice a year. You want to see either your gastroenterologist or your colorectal surgeon. Your family practice doctor can help you with that because each high-risk group has different guidelines. So, for example, if you have polyps yourself, you would get a colonoscopy every 3 to 5 years, whereas if you're of average risk, like most of us who don't have colon cancer in our families, you get a colonoscopy every 10 years after the age of 50.
Okay. I find this particularly interesting. You've listed 6 steps to lowering your risk.
Yes.
That is, as you just said, get the beginning at age 50. Eat between so many grams of fiber each day.
Absolutely.
The fiber, fruit, vegetables are very good for you.
Fiber is in fruits and vegetables. It's the insoluble part, the part that sort of cleans out our colon. And it can actually lower your risk of colon cancer. It's also beneficial because usually the more fiber you have in your diet, the less fat and other toxins you might have in your diet. And so it's a good idea to keep your fiber grams, which is 25 to 30 grams of fiber per day per person. So that's like eating 8 apples a day. It's kind of hard to do unless you take a fiber supplement. And ones like that would be Metamucil, Citracel, Consul. Those are all over the counter and they're natural products.
Also eat a low-fat diet and eat foods particularly that are leafy green things.
That's right. That's exactly right.
So the diet can have a lot to do with this because of, I guess, what lays in the stomach and colon area?
That is true, but the #1 reason is usually genetics. So it's either you are predisposed to having cancer or it runs in your family, and then if you eat a poor diet, that can increase your risk. But we always want to make sure we have lots of fiber in our diet to decrease our risk as small as possible. If you smoke, you certainly want to quit smoking, not just because of your risk of lung cancer, which you can lower by quitting smoking, but it also affects other cancers like colon cancer. And if you drink alcohol, we would want to do that only in moderation. Don't want to increase your alcohol consumption.
And exercise, that figures into everything, doesn't it, this day and time? Exercise, exercise, exercise. So if people have, or particularly, you said women too, because normally we seem to think of men when for some reason when we talk colorectal cancer.
And I don't know why that is, because the incidence of colon cancer is the same in men and women. It is exactly equal. So I don't know why we perceive in men, but I will say what's funny is that women are less likely than men to get their screening colonoscopy. And I can't give you an answer for that one because usually women are very good about getting their screening mammogram, etc. They seem to take care of everybody in their family and sometimes forget themselves. So this month in March, we want to make sure everyone goes to their primary care physician and get a referral for a colonoscopy if you're over the age of 50.
Doctor's orders.
Yes, absolutely.
Thank you very much. Pleasure. Coming up, we're going to, we're going to talk about tunes for the troops. But first...